What if one of the most important skills in healthcare isn't clinical at all? In this episode, Dr. Krishna Vedala and I discuss why connection matters in healthcare. Welcome to this month's mid month meeting of the minds. I'm your host, Swati Shah. How can you build a relationship in less than a year? All right, today's mid month meeting of the minds, I'm going to introduce you to Dr. Krishna Vedala. He is an internal medicine physician, and we both met less than a year ago. And now this is our second podcast recording. The first one is on his channel called Connected by Health. He's an internal medicine physician, as I mentioned, a primary care physician, and I'm going to let him take over from here and let him tell you about how we met and the power of networking and what he wants to do with his podcast, Connected by Health.
Awesome. Thank you so much, Dr. Shah. I really, really appreciate it. Well, my name is Krishna Vedala. Dr. Shah has already given me a great introduction, and I really believe that, especially in the modern digital age, networking is really a key tool, not just growing yourself as a person, but also building your brand and also being able to establish relationships that will allow you to help either yourself as you advance through your career, but also if you're in the healthcare field, help your patients, and it really does come to play a significant role. The world is now small. It is no longer limited by the oceans or the mountains. The only thing that is limited is by who you are. Do you want to go out? Do you want to reach out? Do you want to put yourself out there? Or would you rather just stick to yourself? That's really what the world has become. And, Dr. Shaw and I met, I believe, about 9 months ago on LinkedIn. We were looking at just liking posts from colleagues, and then all of a sudden, I don't remember who connected with who, but that's okay. That's all right. It's hard to remember all those details. And then one final day, she herself reached out to me, and then from there, it's been a wonderful time getting to know Dr. Shaw, having her on my podcast, Connected by Health. But also, the two of us really do believe in the power of networking, and we really do have a great degree of belief in what LinkedIn has to offer, but not just in LinkedIn, but also other ways of networking, whether if that is in-person ways, which she does a really good job with Plans Connect LLC, correct? Is that my pronouncing that
Correct.
correctly?
Yes,
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 yes.
yes.
Plans
And then
Connect.
Plans
Yes.
Connect, yes. And then of course myself, I have really tried my best to really go out there, put myself out there. I'm from Oklahoma City, and I've been gracious enough to be part of an organization and a leadership program called Leadership Oklahoma City. Really gotten a chance to get to know an amazing set of community role players, but also other organizations, American College of Physicians. I've also had the pleasure of going to the American College of Physicians Leadership Day in Washington, D.C., getting to meet a few people. One of them, actually, Dr. Philip Vorhoff, who is heavily invested in putting together a national health insurance program. And he's also going to come onto my podcast here in the next couple of months. So, networking is key. Networking is key to building your brand. Networking is key to growing as a person. But also, it has greater benefits, and it's something that I think is really a must as we enter more and more into a digital age.
That you brought up so many amazing points, Dr. Vidala. I want to go back to one of them. You mentioned something about embracing the digital age and doing
Mhm.
better for your patients. This is a topic I'm very passionate about. A lot of physicians feel it's cringy to be on social media, and they fail to understand that LinkedIn is a platform to actually grow your career from.
Mhm.
And it's not just growing your career by getting more patients. That's not what I'm talking about. But you also mentioned a personal brand. So your LinkedIn profile defines or is an opportunity for you as a physician to define who you are professionally,
Mhm.
what it is that you're passionate about. You're obesity medicine certified. I have been passionate about contraception and family planning. And so, like, patients look at our LinkedIn profile to see if we're credible physicians,
Mhm.
if we're legitimate. And our colleagues look at us when they're trying to figure out, should I hire this person or not? Or maybe I want to go work in that university department. Who else is there? Is it anybody who I could get along with? Or are there already people doing the research I want to do? Is that good or bad? Because is there room for me to add to it? Or does it mean it's a niche that's already filled and therefore I should go elsewhere?
Hmm.
So
Well,
what is, sorry, go ahead.
no, you go ahead. You go ahead. Go ahead. Go ahead.
I was just going to ask you, so what is your passion in terms of the power of networking or where you talked about personal brand? I'm going to let you direct this. Which way do you think it really matters? Building your brand for yourself as your career and or your patients? I know it matters for both, but what's your passion?
I think my passion really, and what's really motivated me in the last year and a half since I've gotten to grow on LinkedIn, getting to meet you and so many others, it's really been getting to acquire knowledge. And the way you do that is by meeting people and then kind of having these discussions and getting to know them and trying to find resources and how you're able to continue to learn, continue to grow as a physician, as a leader if you're interested in on the health information side, or if you're interested, for example, on the obesity side. But I think that's really what's become my passion. My passion is to continue to acquire more knowledge. And the way to do that is to meet people that can offer something different. Now, that doesn't mean that I don't want to meet more than one obesity doctor. That's not what I'm trying to say. What I'm trying to say is as you continue to meet more people, they have something that they can impart you with, wisdom. And that's important to acquire. And sitting in your office is no longer just going to be feasible. And I think you really have to go out there and you really have to continue to meet and grow. And that's really how you can develop as a better person, a better physician, a better, for those that are not physicians, a better healthcare provider, but also as a better leader. And if that's something that you really want to do in your career, you have to go out there and put yourself out there. Now, leadership is not just a position anymore, right? We don't live in a world where only the CEO or the COO is going to have to be going to get the right to say or define a policy or define the culture. Leadership can be anything. Leadership can be you raising your voice, right? And we really need more voices raised with how crazy the world has gotten. So, in a digital age, leadership is not a position. Leadership is defined by who you are, by how you define yourself, but also by how you are able to raise your voice and how you're able to establish yourself on a playing field.
I love it. Yes, when you say speaking out, I think about advocacy,
Hmm.
speaking out for healthcare advocacy, patient advocacy, and it's so important that
Yeah.
we physicians step forward and speak up. Um, I cannot emphasize it enough. We have to speak for the science that we believe in.
Hmm. No, I agree. And if you really look at where we are right now in Africa, we're dealing with an Ebola scare. We're dealing with a measles scare in South Carolina and then Western Texas and Utah. And not to mention the damage that's been done with cutting funding to research. People always talk about GLP-1s and GLP-3 and peptides, but these didn't just show up overnight. There was years, decades, years of research that has been done that has gotten us to this point where today we're really at the forefront of a revolution in obesity medicine. I mean, it just 10 years ago when I was in medical school, we would not have even imagined that GLP-1s would be able to do all the things that they do, but that just didn't happen overnight, right? So we need to continue investing in research. We need to continue investing in our healthcare system. And the only way we could do that, especially in the threat of massive cutting to funding, but also just a shift in the lack of evidence-based medicine, the lack of a criteria that needs to be set for establishing policy. The only people that are going to be able to speak up to it are people that have the experience, and that's physicians, right? We spent
Experience and education. We've
exactly,
studied it. I mean,
exactly.
the researchers have spent their lives dedicated to it. And when they put it into clinical translation, then we physicians have to speak up.
Hmm.
Yes,
Yes.
so
No,
true.
I completely agree. One of the things that I will say, and this is something that I think some people may not like to hear. But we also, in addition to living in a digital world, we live in a post-truth world. We live in a world where people want to listen to what they want to listen to, but no one is really looking at truth. No one is really looking at the evidence. Yeah, that's great. It's great for networking. It's great for, I mean, not, but great for network. What do you call it? For like Fox News or CNN or MSNBC ratings. That's what I meant by networking. But it's not really great for reality. When you don't really live in reality, at some point, whether if that is today, tomorrow, or a couple of years down the road, everyone's going to have to face and accept that reality. And we're looking right now at a reality where we're probably closer now to doomsday than we've ever been in our lifetime. And that is frightening. And that is including even the Cold War, right? When you had two nuclear powers, now you don't know what's going to happen. Now anybody can build a nuclear weapon in their garage. Now anybody can release the next major viral pandemic in the middle
Okay,
of
okay. So, no, we
America.
don't want to scare anybody. Let's talk
I
about
know, I
how we
know.
can break out of
I,
these silos. We need to encourage physicians to speak up. We need to encourage them to network. And I think in this digital age, we do have an opportunity to transform our communication skills with
hmm
each other, with our patients, with administrators, with insurance companies. You brought up the subject of GLP-1s.
hmm
And, I keep seeing advertisements from a telemedicine company that says that you can now get it covered by your insurance. Well, unfortunately, if you do not have employer insurance coverage, if you are a solo practicing physician, an entrepreneur, a solo business owner like myself, a restaurant owner, a fashion designer, a musician, a waitress, these people do not have employer-based health insurance plans.
hmm
And those medications that we now have available are not accessible to them. One of the other topics you mentioned in your work was a podcast coming up with someone who believes in national health insurance,
hmm
which, as you know, because our nation has tried to embrace that, and there are so many that are against it. But I want to know what we do for health insurance for the people who do not have employer held health insurance.
Mm.
That is probably 50% of the city of New Orleans.
Yes.
Any city with tourism as a major part of their economy, they do not have employer-based health insurance. So what
hmm
are we doing for them? How are we communicating access to care? Where's the network?
Well, we're not, and that's the problem. And that's why I believe we as physicians need to continue to network, continue to build trust amongst each other, but build these relationships that will allow us to speak up for those people without health insurance. And the other thing is of course, with the big beautiful bill, that number is only going to go up, whether that's New Orleans or Oklahoma or California. I feel right now the issue is we're at a moment in history where if the people that have spent their lives dedicated to learning medicine and taking care of patients speak up, you could really create something good. Whether if that is a national health insurance system or some form of universal health care, there's not really any specifics that I specifically advocate for because anything is better than what we have right now. Part of the reason I also put together my podcast is to help people that do not agree with that form of a healthcare system, to help them realize, guys, we have been doing this the capitalistic way of a mixture of random different healthcare systems put together. It hasn't been working and it's not working and it's only getting worse. And that's what I hope to do with my podcast. But part of that and putting that podcast together meant connecting with people from across the spectrum and not just in medicine, but we just had a wonderful guest about renewable energy resources. It's all connected. At the end of the day, you need clean energy in order to help limit the chronic illnesses that you get from exposure to fossil fuels. So networking is key to that. Networking is key to advocating for your patients and just for the general population.
I love it. So let's give our listeners a call to action. Networking is not just about going to a cocktail party and shaking hands
Mm-mm.
and toasting things. There are digital methods of connecting with others. You and I met through mutual colleagues and posts that reflected our medical interests on LinkedIn. There are other platforms. I know many of the younger generation look at TikTok.
Mm,
And the challenge is to weed out the medical influencers from the medically, scientifically trained individuals. I think if we could encourage our colleagues to speak out and do more
hmm
patient education, if hospitals and those hospital institutions supported physician-led education on their platforms, I get a monthly little 8-page pamphlet from a hospital in my neighborhood, and they have little articles written out by different physicians they feature as spotlights. But
hmm
what if they converted that to an online TikTok instead, or a LinkedIn platform? I've I've found in years past that healthcare is very reluctant to embrace social media.
hmm
And I do think there is a call to action. We need to raise our voice and we need to speak up. So, and that's why I'm glad we've connected, because you're doing that with your podcast. What other calls to action can you recommend other than people should follow your podcast, Connected by Health? And this is Plans Connect. I'm on YouTube. And what platforms is your podcast on?
My podcast is on almost all the podcast platforms out there. We're on Spotify, we're on Apple Podcasts, which has been our primary platform. We're also on YouTube. We have converted all the episodes in onto YouTube also. So we're discoverable on all platforms right now. As far as anything else that I can talk to our listeners or state to our listeners, at the end of the day, try to find the truth, base the evidence, find the evidence and eventually, try to emphasize the need for truth. That is key to helping not just ourselves, but also helping those around us. And at the end of the day, the data doesn't lie, the evidence doesn't lie, but reality is always something that is important to live by and to live in. And it is something that I believe is an issue that we have not done a great job of as a society in the last couple of decades. And that's part of the reason why we're in the mess that we're in right now. But if anything else I can tell to our audience, seek the truth, focus on the data, and then advocate for yourself and for your patients.
Love it. Everybody, thank you for listening in. This is Mid-Month Meeting of the Minds by Plans Connect. And thank you, Dr. Krishna Vedala. He's the founder of the podcast called Connected by Health. And we'll see you next month. Thank you.
Thank you.
If you enjoyed this conversation, please subscribe to the Plans Connect YouTube channel. We release a new mid-month meeting of the minds conversation every month, featuring leaders in healthcare, public health, innovation, and professional development. Thank you for listening.